there. Thank you for joining me once again on the program, Your Doctor in COVID. I'm Dr. Mahendra Carpen. I'm the head of medical services and cardiology at the Georgetown Public Hospital Corporation. Today we continue our conversations around the COVID-19 pandemic. And remember, if you have any questions or comments, feel free to send us a WhatsApp message to 620-6275 or send an email to docandcovid@gmail.com. Today we are talking to Dr. Tracy Bovell, an emergency medicine specialist at the Georgetown Public Hospital. Dr. Bovell has been in the middle of things, in the thick of things since the start of the pandemic, first as a doctor, but now has merged several roles into an administrator and a leader in the fight against the COVID-19 pandemic. She has been instrumental in HEOC, which is the Health Emergency Operations Center. You're right. And she will tell us a little bit about herself. Welcome, Dr. Bovell.
Thank you so much, Dr. Carpen, for having me here today.
Good. So tell us a little bit about yourself, where you're from, your background, etc. You're Guyanese, I assume?
So I'm 100% Guyanese.
Very good to know.
Very good indeed. 100% proud Guyanese. I started off my medical career as a medical technologist. I did microbiology. Okay. And then I went to Cuba and I did medicine. After medicine, I returned. I was working at the Lethem Regional Hospital and as the regional health officer acting at that point in time. And then I came over to Georgetown Hospital to start my residency in emergency medicine. I have since graduated from emergency medicine, and this year, 2020, things took a little change, a little different.
All around the world. So
now, from 2020, I am the chairperson of the COVID-19 task force at the Georgetown Public Hospital. And now I'm the doctor in charge at the Ocean View facility.
And I must commend you on all of the hard work and excellent work that you have done in leadership role, both at the Georgetown Public Hospital and the Ocean View facility that now looks after the majority of our COVID-19 sick patients. Congratulations and thank you very much for the service that you are providing to Guyana.
Thank you very much, Dr. Carpen.
What made you choose emergency medicine as a field of study?
Emergency medicine, I chose emergency medicine because I love emergencies. I love the simple fact that patients can come in very sick and you have some amount of time to turn it over. Back in the days, they used to speak of the golden hour. Right. That period of time that, you know, as soon as the person comes in, they're really sick, and then within the space of an hour, within the space of a half an hour, you can actually see them maybe walk out of the emergency room better, or they go to the ward, or they're able to now speak to their relatives.
Right.
So that actually drove me to emergency medicine, to actually make a difference, to see people get better, to see little ones not cry because they're in pain, to see an older woman who is having a chest pain or just complaining of generalized weakness, she's diagnosed her with a heart attack and be able to treat her. So there are those things that were, you know, really and truly pushing me towards emergency medicine.
Yeah. So now comes 2020 and the whole world has been turned topsy-turvy essentially, and we start to refocus. So how did you become involved in the COVID-19 fight? You're an emergency room specialist. I'm sure you're busy dealing with accidents, heart attacks, all kinds of other stuff. How did you become involved with COVID-19?
So essentially, Dr. Carpen, I'm also mass casualty specialist. And because of the fact that I saw what's happening in China, in Wuhan, China, I spoke to our Director of Medical Professional Services, informing him that, hey, let us talk about the plan, because I was thinking of it more as a mass casualty aspect of it, because you're seeing the amount of persons being affected for it. And so I think that's where, since January, where we actually started making preparations, and that's how come I ended up being involved in COVID.
That's a very interesting approach and view of the COVID-19 pandemic as a mass casualty. And I'm sure all our listeners and viewers are aware of what's happening elsewhere in more populous locations like the US, for example, where they've had tremendous numbers of sick persons overflowing and taking over hospitals and even on the streets. Did you at any time anticipate us having a similar situation in Guyana?
No, I didn't.
Okay.
To be honest, I thought of Ebola, and we did preparations just the same for Ebola. And we were very grateful not to have Ebola in Guyana.
Right.
And then March the 11th happened.
Right.
On the 11th of March, we actually got our first diagnosed case. And from there, we've been having more cases on a daily basis. And so, yes, even though we did our preparations, we participated in training, we started teaching people how to use their mask, use their protective equipment, use their gloves, how to take it off, how to put it on appropriately. We started checking out our ports and ensuring that our ports, to see how we can, what is missing from our ports and what we can do better to ensure that it doesn't come into our country. Even though we did all of that and many other things, we didn't expect it to actually come, you know, with this force as well.
With this force, yeah. Were you actually in the emergency room at the time when this first patient came?
The interesting thing is that I was at the cultural center giving a talk on COVID-19. On COVID-19 and telling people about COVID-19 and telling them how to put on their protective equipment and how to use their protective gear and how important it is to wear their mask, and if they're wearing their mask, wear it properly and appropriately and wash their hands. That's what I was doing at the cultural center. And I was called and I got a call saying, Pavel, we need you in the emergency room. There's something happening. And from there, when we arrived, everybody, they had already done the test. We were waiting on the results. But the history just sounded so very much COVID. And from there, meetings, protocols, everything started stepping in as well.
What was the mood like among your colleagues in the emergency room in that first 24, 48 hours?
So I can tell you, everyone was pretty scared.
Absolutely.
It's pretty scary. No one likes the unknown.
Right.
And anytime you have an unknown illness and you don't exactly know initially how to treat it. Yes, you have other illnesses that sound pretty scary to the regular population, but at least you know what to do.
Right.
So you know, medicine has taught you already that if you give this medication, your patient can get better. And that's a difficulty with COVID. Sometimes you have given them all of the medications that evidence-based medicine has actually taught you to do. Because as time has gone by, we have realized that, you know, other countries have done other studies. But even with the medications that you're giving, sometimes they don't actually turn around.
Right.
They do not get better. Some of them actually die. And so even though we were scared initially, the simple fact that people are dying still, nobody really likes that feeling.
Right.
You go into medicine to actually save lives. And so when you have something that is actually going to not allow you to completely save someone's life, no one likes that concept.
Right, right. So you talked about the early couple of hours, 2-3 days. Then we started making protocols, putting together task force, involving more persons, and you were immediately in the lead at that level. How do you recall the first or the early days of COVID in Guyana, like the first month or so? What were our main challenges, victories? What was happening at the time?
So initially, I think in Guyana, our first few months or few weeks at GPHC, we were having daily meetings.
Right.
And you would remember that, Dr. Carpen.
Yes, I do.
We were having daily meetings, and every day you think of another logistic that you need to clarify. you need to document, you need to write another protocol to ensure. So it's not just treating the patient, but ensuring that you protect the staff, you protect the public that is coming to the hospital, you protect every patient that is coming to the hospital. You also try to, that is when we started off with our screening policies, so that not everyone comes into the hospital, and you reduce the numbers of persons entering the facility. Because as we have said before, the ones that are in the hospital are pretty sick, so you have to protect those. We also started our East Street triage area and all of the other triage points and screening points at the Georgetown Public Hospital, and those really made a difference, because in that way we were able to pick up patients that are potentially COVID-19 positive, and we were also able to educate persons as well. In our screening areas, we were able to detect persons that are suspected COVID-19 and redirect them to the appropriate area so that they can get care.
Yeah. So you've been in the task force, you continue to meet, you continue to refine things, continue to plan, continue to anticipate. What has impressed you most about the group that you're working with?
They're talented.
They're very talented.
They're talented, and it's not just medically talented, they're talented. We sat down and we were able to figure out what people would say maybe the nitty-gritty of things.
Yeah.
So the ambulance needs to move from point A to point B. What do we need to do to get that from point A to point B?
Right.
Who do we need? Which route does that ambulance need to take? They're so meticulous and it's an excellent team.
Yeah.
It's an excellent team, and it's an actual honor that I am actually part of that team.
I can tell you what impressed me the most. I looked in that room and people around the table, and they're all young, properly trained, completely dedicated Guyanese. From a national point of view, each one of them have another 20 to 25 years of service to provide because they're in that age group. And that bodes well for our future, don't you think?
Definitely. Yeah. And highly qualified indeed.
Yes.
Highly qualified
driven,
young persons.
Committed, and qualified.
Yes.
So, since those early days to now, how have things changed in your views managing COVID from a Georgetown hospital or a national level?
So things have changed in that we're more au fait with the illness, and so we're able to pick it up at a faster rate, and we're able to isolate persons even better. And with the opening of the Ocean View facility, we're able to actually try to take COVID away from the Georgetown Public Hospital Corporation, so that they can resume things like elective surgeries and other clinics that are still needed.
Right.
So yes, we did make decisions where you would have longer clinic dates, and doctors and nurses would actually go to patients' homes and actually visit them. So those decisions were made, but you still need some people to actually come in.
Right.
So you need those clinics to reopen. You need the facility to be able to do elective surgeries as well, because you'll have a backlog of surgeries it's been how many months now?
Right. So have we started back doing surgeries? So
we're doing surgeries, but not elective surgeries per se. We're doing emergency surgeries.
Okay.
Yes, emergency surgeries generally.
And are they in the regular location operating rooms, or were there different locations created?
Oh, no. So definitely, so it depends on the situation. If the patient has been cleared of COVID or clinically cleared of COVID, we can do the regular operation theater. But we also have a COVID-19 operating theater, so that you can, if you're a suspected case of COVID or if you're confirmed for case of COVID, we can safely operate in you in there. After which, before it is sanitized, and it's sanitized after every surgery as well.
Right.
So it's a safe environment, and it's also a separate environment from the other patients who have nothing to do with COVID-19.
And this was created?
This is something new that was created for COVID-19. Created so that we can safely still do emergency surgeries and protect not only the patient, but also the staff and other patients that will be coming as well. That's why we also created our ICU, and we actually fixed that structure. We started in February, very early February. started creating that facility so that you'll need intensive care. Most of these patients ended up needing, quite a few needed intensive care, and you couldn't put those patients in our intensive care units with the other regular patients. So you needed an area, facility, where you can have direct access to it from the road instead of going through the hospital.
Right.
And so that's the same reason why we created the intensive care unit, so that COVID-19, you've realized that COVID-19 patients still have emergencies, and they still need intensive care, and they still need escalation of their care. And in order for them to get that, we have to have definitive areas. Right. And that's why, for example, with maternal patients at the Georgetown Public Hospital, we also have the isolation area that is separate, so that we can ensure that if we have a suspected case of COVID-19, we can definitely isolate you and ensure that you're safe and the other patients are safe as well. You and your baby safe. Mm-hmm. And for babies as well, we have another area designated for this.
Thank you so much, Dr. Bovell, for all the effort, and thank you very much for taking the time to come and speak with us today. Remember, viewers and listeners, if you have any questions, please feel free to send us a WhatsApp message to 620-6275 or send an email to docandcovid@gmail.com. When we come back tomorrow, we will continue our conversations with Dr. Tracy Bovell, emergency medicine specialist at the Georgetown Public Hospital Corporation. Thank you once again.